So my name is Trixie McAree, as Sue has said. And if you'd have told me in February that that we would be in lockdown now, I would have thought that was strange. So my job had been at that time going around the country supporting people and helping maternity services set up their continuity of carer teams. And now, obviously, I haven't been able to do that. So I've had the opportunity to work clinically with people. And what I want to think about today is operating and inspiring each other as midwives, and celebrating together for what all of us are able to achieve. So this session is really all about midwives. And what I want us to think about is how we can inspire each other, how we lead each other, support each other, commit to each other, and celebrate everything that we're doing. So let's think about inspiration. What I think we want to do through this crisis is think about what innovation has taken place and celebrate it. So Tracey's given us a whole list of the 71 change management things she had to do up north there. In Birmingham Women's, we had to we set up a telephone triage, for example, in a very new way of working. We moved services around. We managed to keep our home birth team. We've managed to keep 2 continuity of carer teams running despite all this. So what we want to look at is what is good that we could keep hold of, and how do we keep hold of it, and what have we changed, and actually what have we changed for the better, and think about that. We all want to be inspired. Whenever you read any kind of leadership stuff, they always say, yeah, you need to inspire people. But actually, all of us as midwives are the inspiration. And inspiration is when we get enthusiastic about what we do. So, for example, today I was working on our birth centre, and I worked with a student, and we had the most lovely birth, we thought, and the woman thought, which was very woman-led, and the woman stood up and she was mobile and she was able to eat and drink in labour, and it was just a really positive, enthusiastic experience. And we were able to sit down and talk to each other and inspire each other about remembering what good midwifery looks like. And that is something we can do despite sitting in a crisis. And that's what I want us to remember. In 2018, the RCM published the Whelm study that some of you may have seen, and it's kind of highlighted how stressed and pressured midwives were. Well, actually, we can use this crisis to move forward out of where we are and think about where we would like to be, and see the strength that we have in managing this crisis, in moving services around, in coping with different things, in accepting that 1 minute there's one guideline and the next minute there's a new guideline. 1 minute we're putting on masks, the next minute we're putting on 3 gloves, and all the different things. And that shows how strong and how versatile and how able we are. And that's what we want to celebrate. And then we want to use that strength, recognize that strength, and move forward and inspire ourselves to think, well, how do we want maternity transformation to look once this crisis is over and we can go back to something that looks vaguely more normal? But we want to think about, what should normal midwifery look like? What is the midwifery of our future? We want to think about how we now embrace maternity transformation, continuity of carer in particular, and how we can do that based on the lessons we've learned through this crisis. We want to share all the innovations. I'm sure maternity units across the country have done many amazing things. We want to gather those things together so that we can learn from each other and share all the best practice out. So I'm happy to accept any emails telling me about what people have been up to, just that we can collate it somewhere if that's what some people want to do. But it's really about getting inspired and thinking about what should recovery look like. So that's the inspirational element. But in order to be inspired, we need to start off with our values, because our values are the things that drive us. So our value is what makes me get up and do something in the morning. So I have a personal value that I've held for a very long time. And that is that I very strongly believe that what I want to do as a midwifery leader is empower midwives to empower women. We want people to take responsibility for their own health. We want them to do things like stop smoking. We want them to make healthy choices. but we can only do that when we feel empowered ourselves to be able to do it. So that's one of my values. The other value is in recognizing that midwifery is not just the safe delivery of a baby. It is actually a huge public health issue where, as we do midwifery well, we ensure that there are good long-term health outcomes. For example, people less likely to get cardiac disease because the mother and baby dyad were healthy at the beginning and throughout the pregnancy, but also influencing things like maternal mental health and mental well-being. So, because we know that when women are well, they are more able to talk to their children and bond with their babies, and those children then go on and do much better at school, which then changes long-term outcomes. For example, it enables those people to grow up and do well at school and get a job, and so we're actually tackling health inequalities as well. So getting your own set of values and working out why you're a midwife and why you want to do that is really important, and that then influences our attitudes, that changes our behaviors. So we all lead, and that means what we say and what we do makes a difference. So when we've got our colleagues coming, for example, with an innovation, how do we respond to that? Because our responses make a difference to whether things are accepted and whether things fly or not. But in order to influence and lead, we need to have a vision, purpose, we need a plan, we need to play to our strengths. That means we need to know what our future should look like together. We need to know why we're doing it, which is where the values comes in. And then we need to work to a plan together, and then also understand who we are. So if I was a right-handed tennis player, for example, there's no point in me practicing to try and play tennis with my left hand, because that would never do. We need to understand who we are and the part we play in all of this. And between us, we should be encouraging each other and looking for ways of building each other up, so we do start to play to our strengths, to lead with our values, and then we lead by example. So we get up and we do what we say we were going to do, and we shouldn't be saying they should be doing, but we should be doing what we think we should be doing. So then it comes to thinking about, well, if we're going to do this, we need to be able to support each other. Now, the obvious place of support, as we know, is the professional midwifery advocacy process. And in case anybody's forgotten, in the A-Equip document, it tells us the PMA is the new fundamental leadership and advocacy role designed to deploy the A-Equip model. The role supports staff through a continuous improvement process that aims to build personal and professional resilience. So PMAs are there to support us. They can do things through restorative clinical supervision, and they can also help us think about new innovations to make our services better. When I was doing the national review, one of the midwives said, PMAs are pivotal to our roles as midwives, and they assist us with both practical and emotional support. And so that's actually what they're there for. And we can use our PMAs, particularly in this time of crisis, if we're feeling stressed or stretched or in an experience that is unfamiliar to us. So we have somewhere to go and talk. Now, the national team did think about setting up a national solution, a helpline, like a PMA helpline, because the line of thought was midwives are too busy to be able to provide that within in-house services. But then looking at best evidence, it seems that is not the best way of going. And what we've learned by looking at the best way of supporting each other is that care needs to be, in the first place, proximal, which means that care needs to happen within teams. Teams look after each other. We have a sense of connectedness and a sense of belonging, and that enables us to look after each other far better. Second thing is that care needs to occur immediately. So if someone is feeling stressed because of a clinical situation or something that's happening at home, it needs to be dealt with quickly, and that issues need to be dealt with as they occur. We need to look at our situations, understanding that an end is going to happen, and any solutions that we put in place need to be kept simple, because what we want to be doing is maintaining normality as far as possible. So when you think about how we support each other, you can see there you've got the acronym PIES, should help us to think about this and to help us to remember that support happens within the context of the team. That means that all of us, it doesn't matter if you're the most junior midwife in the building or the most senior, we can walk around, we can talk to each other, we can check in with each other, and we can make sure that we're all doing okay, and see that, you know, if someone's looking a bit frazzled or stressed, we can always just say, how can I help? And that gives a space for someone to accept your help or not, as the case may be. Now, there's a lovely example of good practice in Tame and Glossop, where a lovely midwife called Nicolette Peel is shielding because she can't come to work. And what she's done is she set up 2 PMA Zoom restorative supervision sessions. So on the one hand, she's doing a restorative supervision for the midwives that are working clinically, and running that as one restorative supervision session, and then she's doing another one for midwives who are feeling at home, who are maybe feeling a bit, I wouldn't like to use the word left out, but I think it's very difficult when you're not busy doing. Sometimes that feels difficult as well. So she's running a session for them. So that's a good lesson for all of us, and she's doing it by Zoom, which is making it much easier for people to access that service. Teams are just desperately important. We can't underline that sufficiently as we try and inspire each other, as we try and support each other, as we celebrate what we're doing. The best way this comes out is within the context of teams. Now, most of us are familiar with Michael West's work. He's been looking at teams within the NHS for many, many years. I don't know how many. And his conclusions tell us that when we work well in teams, we come to work because we're really happy about coming to work. We enjoy our work far more. We make a lot less mistakes at work because we feel confident to ask each other when we get stuck with something. And therefore, patient outcomes, or women's outcomes in our case, are far, far more successful when teams function well. And this is very, very important, obviously, within the context of being in the middle of this COVID crisis. So I wanted to just do us a little slide on committing to teams and thinking about being committed to each other and how that works within the context of teams. Now, there are many different books about how you need to run your teams and the best way of doing it, but I rather like Patrick Lencioni's explanation. So he says there's 5 ways that teams either work well or don't work well, depending on the circumstances. And he's done it a bit like Maslow's hierarchy in a triangle. So the first thing we have to do when we work in a team is that we have to trust each other. If I don't trust you, I'm not going to come out of my room and ask you about that fetal heart, or I'm not going to come out and ask you about my trace, or I'm not going to ask you about feeding the woman, or whatever it is that's concerning me, if I don't trust my colleagues. So the most important thing is we need to learn and decide to trust each other. The second thing is, in a team, it's okay to have conflict. We are afraid, I think, as English people in particular, of disagreeing with each other because we might offend somebody. But actually, there's nothing better than a good disagreement, because in discussing things, you say one thing, I say something else, it doesn't mean that we don't like each other. It just means that we're thrashing out, looking for the truth, working out what the best answer is going to be. And what we have to do is say, well, we're going to allow conflict and encourage conflict within the context of our teams, as long as it's boundary conflict. And that means that we then, just because I don't get my way or you don't get your way, it means that we don't work together or we don't like each other anymore, because it's not a competition, but actually we want to work. We want to come to the best solution, and that means sometimes being free to have the conflict, but at the end of the day, agreeing to disagree where appropriate. We need to be committed to each other, accountable to each other, and then focus on what's most important, and that's giving the best possible care to women. So that brings me to my final slide, which is we need to celebrate who we are and what we can do. Every day might not be a good day, but there is something good in every day. We need to keep smiling at each other, because that makes a massive difference. So I don't know if you can see this, but as I just said that, I can see Tracy and she smiled at me. And that's just the most encouraging thing ever when we work, because we need to keep affirming each other. look for ways of paying it forward and serving each other. I cannot underline the importance of servant leadership, actively listening to each other, asking each other what we think about, thinking about how we respect each other, trusting each other, being vulnerable to each other, admitting that we don't know everything. That's a really scary thing. And out of all that, we celebrate who we are together as midwives, and together we will then find a new normal going forward, and we will survive this crisis. Thank you very much for listening to my presentation.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.